So now we shall move on with our second talk for this session. For this session, I am delighted to introduce staff nurse Mastura Muhammad Rashid. She is a palliative care nurse who is also working with Hospice Malaysia. She graduated from Mahsa University College before embarking on a career as a nurse in Subang Jaya Medical Centre, SJMC. She has been working in community palliative care for more than 7 years now and will be talking to all of us about coping with fungating malignant wound at home. The stage is yours, Mastura.
Hello everyone, my name is Mastura. I am palliative care nurse working in Hospice Malaysia. Today I'm going to talk about how to manage malignant fungating wound at home. So today you're going to learn about what is fungating wound and what type of fungating wound, the symptoms that might occur to patients, and what are the impacts and how to manage fungating wound at home. And also I will end the presentation with a case study. So what is fungating wound? Fungating wound described as a conditions of ulcerations and proliferation which arises when malignant tumor cells infiltrate and erode through the skin. It can be indicated as poor prognosis and also advanced disease. And we commonly see this kind of wound at patients with breast cancer, skin cancer, head and neck, and also gynecological cancer. There are two types of wound, which is cauliflower appearance and also ulcerative type. I'm going to show you the example of these both types. Here is the cauliflower types, and this is the ulcerative type. And now, how are we going to assess the wound? Actually, the moment we enter the patient's house, we can start doing the assessment. We might smell something bad, that possibly from the wound itself. Okay, let's look at Mr. A. We can see there is a cauliflower type of wound and it is over the neck region. And we can also see there is a blackish color on the wound. So it can be necrotic tissue. It can be part of the dressing material. We can also see there is a bleeding there and also there is some slough. And the size of the wound is quite big. Then we need to know whether this wound has been exposed or is been covered with dressing. We also need to know what are the possible complications that Mr. A has. For example, is there any underlying infections? Is there any fistula formations? Or is there any symptoms that Mr. A has? Why all this information is important? It is because it helps us to choose the right dressing to teach the family member and help us to be more proactive in preparing the patient and family regarding possible complication. For example, Mr. A's wound is very near to the carotid artery. What if it ruptured? It can cause massive bleeding. If we didn't prepare them earlier, they will be panicked and send patient back to the hospital. We are actually creating an emergency situation for patients and family. Let's talk about the symptoms that commonly patient reported, such as pain, bleeding, exudates, and malodor. As usual, we need to assess these symptoms. I believe every one of us is very familiar doing pain assessment, so it's nothing new. We need to know the onset, how long it lasted, is it intermittent, and we also need to know the nature. Is there any neuropathic involvement? How severe is the pain? And what are the aggravating and relieving factors? And if the patient is taking any analgesic, is this analgesic helpful? And what are the impact of the pain to the patients? And for the bleeding, we need to know the amount, how much it is, and what type of the bleeding. If the bleeding only occurs upon removal of dressing or is a spontaneous bleeding. And for the exudate, we also need to know the amount, the color, and also to know the quality of the exudates, whether it's a serious or purulent type. And for the mild odor, we need to know how bad is the smell and how much has given impact to patients and the family. Bear in mind the patients will not only have these four symptoms, they may also have other symptoms that caused by the underlying disease. So it is important for us to do a thorough symptoms assessment. After we do the assessment, we also need to understand what are the impact of this malignant fungating wound to the patients and also the caregiver. We start with the patient first. Patient will be affected psychologically, socially, and also spiritually. Often, patient has social isolations because of the altered body image. They feel they are not normal anymore, especially if the wound is visible. It will also cause them to have low self-esteem. Because of the wound, their relationship can be affected too. And patient always afraid isn't enough support from the healthcare provider in the community, especially after they discharge from the hospital. They wouldn't know whether they get the support from the healthcare provider, from the GPs, or from the caregiver to help to assist them on managing the wound. Let's look at these patients. What do you think the impact of the wound on him? We can see there is a cauliflower type of wound over the perianal region, and also there is a sacral sore as well. So what possibly might happen to him? That's the reason why I say it's important to know the locations of the wound, because it will give impact on the patient's functions. Like Mr. A, the wound is over the neck region. He may already having problem in swallowing, speaking, hearing, and see things. And like the patient who has a perineum fungating wound, he may have problem in passing motions and urine. Imagine if he pass motion, it can be very messy and it can actually induce infections if we didn't teach the patient's family how to care for this wound properly. And the wound may also affecting patients' functions, like mobility, their ADL, and also their sleep. And do not forget to also assess on their nutrition intake. If the patients start to have weight loss, then we need to do a thorough assessment whether this is partly from the fungating wound or from the treatment or from the disease progressions. If the patient are still undergoing treatment, it will be good to get the dietitians involved and give advice on the diet intake. But if the patient's already towards the end of life, then it's important for us to have a conversations to address these issues. Let's talk about the impact on the patients and the family. They often reported that they're afraid to do the dressing because they may induce pain to the patients. So things like removing the dressing looks simple, but it can be a huge impact on them. And bear in mind, there is also change of role here from family member to a caregiver. They also need to give up the social and leisure activities and also their social roles, especially when the demand of the wound is getting more. And financially can be affected too because the cost of dressing material and medications can be very pricey. How can we manage them at home? For pain, is depending on our pain assessment. If the pain is just minimal, prescribing adjuvant will be enough. However, if the pain is very severe, prescribing opioid like morphine or anti-neuropathic if there is a neuropathic involvement. And if you've noticed there is infections going on, then prescribing antibiotic will be our management. If the patients complain of pain during the dressing, then we should start patient with short-acting opioid like morphine prior the dressing. Usually, I would advise 30 minutes to 1 hour before dressing to give the morphine first, so that during the dressing, the patient won't be in so much of pain and the family member will be more comfortable doing the dressing. We should also suggest to use appropriate dressing, like something not sticky. Yeah. So sometimes what I suggest to the patient family to put a Vaseline first before on top of the gauze before cover it on the wound. And we can also use the relaxation techniques like music, massage, imagery, or aromatherapy that can also help to reduce the pain. For bleeding management, I will divide it to three: preventive, minor, and major bleeding. Preventive measure, we usually suggest the family member to soak the dressing and remove it gently to prevent contact bleeding. You may also suggest the family member to use non-fibrous dressing to prevent the dressing material to stick onto the wound. For those who have minor bleeding, you can also suggest them to use a cold saline. So how to do it? Either you advise them to put the saline into the fridge or get the ice cube to put into the saline while doing the dressing. And we use absorbent dressing like Gumji or a sanitary pad to actually absorb the bleeding, and eventually it also will help to stop the bleeding. For those who can afford to use a hemostatic alginate like Caltostat, because it's quite pricey, you can also suggest them to buy and apply it on the wound. And these also are very good for for stopping the bleeding. For major bleeding management is all about proactive interventions. So like I said earlier, if we know that the wound area is near to the big artery like carotid or femoral artery, we should actually educate the family member and the patients about the risk of massive bleeding. We can also advise them to prepare dark colored towel so that if it happens, the patient won't be too panicky to look at the fresh blood, or the family member will not be traumatized with the fresh blood as well. For those who are able to prescribe the crisis medication like midazolam or morphine as a anticipatory medication, this something can be done as well for comfort. And radiotherapy can also be discussed if patient has a good performance status, but of course you need to get the oncology team to be involved in these discussions. There are many dressing material can be used to manage exudate alginates, foam, and hydrofiber dressing and also absorbent pad because they are very good absorbent dressing. If the patient has a low exudate or minimal exudate, you can also suggest to use hydrocolloid like duodenum patch. And if you notice patient has more exudate, you also need to suggest to family member to apply zinc oxide surrounding the area to prevent skin excoriation. Otherwise, it can cause pain over the excoriations area. For the mild order, we can actually use topical metronidazole or charcoal dressing as a secondary dressing to prevent the odor if it's minimal. But if too strong, you may also prescribe metronidazole orally so that we can control the odor better because of the infections. And you can also suggest to use a silver impregnated dressing, but I usually don't use it because it is very expensive. Here I just show you the few example of the dressing material, like Cortostat, the alginate dressing, and also a few of the hydrofiber and also silver dressings. So whatever that you see with AG, these are the silver impregnated dressing, but they are very expensive. So for those who can afford, so you can suggest them to use. But for those who can't, you can also just use absorbent dressing as what I said just now to control the odor and also the exudate and also the bleeding. I'm not here to promote all this brand, but this is what I have in my setting. So I just show you some of the example that we have in the market. These are the example of the absorbent dressing, absorbent pad and gumji, and also charcoal. You can see here in tablet form. So usually we ask the family member to crush it and put it as a secondary dressing. We don't advise the family member to sprinkle it directly on the wound because it may cause us having difficulty to assess the wound. We cannot see whether got any bleeding underneath it or there is a necrotic or any slough because it's all covered with the charcoal. For psychosocial and spiritual aspect, it requires a good communication skill. In order for us to treat the patient as a person, we need to explore, get to know them. What are the impact? What are their concerns? And we need to address those concerns and also acknowledge their difficulties. And many of the patients, they just need an ear to listen to their stories, their feelings. If you could give a practical advice to improve their body image, this something can be done as well. For example, if the patient has a wound over the neck like Mr. A, you can actually advise him to use a shawl to cover the area. But if let's say the wound is too big, it can be difficult as well. So get to know your patients and give appropriate advice. In the spiritual aspect, we need to explore the meaning of their life, and we can also use a life review as a tool to help them to find values in the past achievement that can be used now during this difficult time. After we assess and manage the wound, we also need to assess their coping mechanism as well. So, in terms of knowledge, is the family member and patients understand about the disease and what are the expectations of the fungating wound? Some of them may actually expect the wound to be recovered. And for the skill part, you also need to evaluate the way how they do the dressing and the symptom management. Is there any challenges and difficulties that they are facing? In terms of attitude, we need to check how confident they are doing the dressing. Um, are there any fear or anxiety towards dealing with the wound or change in behavior or care? These are the factors to consider in managing the wound at home, the goals of care, the financial situations, and the support system that they have. Okay, now we are reaching at the end of my presentations. I would like to end it with a case study. Let me introduce you to Madam Anne. She is 82 years old with advanced peritoneal cancer. She is a widow with two sons, both of them staying nearby, and she is staying with one domestic maid, alias caregiver. These are the four main issues reported by the patient: abdominal pain over the fungating wound and bleeding. And also, she feels that she's not being normal anymore and there's no meaning of life. And then I start to be curious why. So, how do you manage? For pain management, is controlled very well with opioid. Like I said, I'm very curious why she said that she's not normal and she has no meaning of life. When further exploration, she said that she feels that there's no point for her to actually pray to God because she's not clean due to the bleeding. So that's the reason why I highlighted the bleeding and also sanitary pad, because she feels that with the bleeding stain on her clothes, she's not clean and God will not accept her prayers. So, what I suggested is using the sanitary pad as absorbent dressing, and we also prevent the blood to oozing out and stain on the clothes. This is how it looks like after the sanitary pad was applied. The patient was very happy with this method because she now feels that she's back to normal and she able to pray without the blood standing on the clothes. So Madam N taught me on how to actually having a good communication skill and also having a thorough assessment to understand the real problem and also helping them to cope with malignant fungating wound at home. A simple thing like sanitary pad is really make huge impact on her spiritual aspect. With that, I end my presentations. If any questions, we can discuss during the Q&A sessions. Thank you.
Thank you very much, Mastura. Yeah, I do think we face quite a number of different types of wound in our setting whenever we are caring for patients. And it's important to look at them as a person and to manage it in the way that we should manage a person and not just managing the wound itself without looking at the patient. We'll soon move on to the next session.